Chain Drug Review and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. Today, we're thrilled to have as our guest Crystal Lennartz, newly named President of Health Mart and Health Mart Atlas. Crystal, congratulations on your appointment. Great to have you with us.
Thank you so much, Jeff. I'm happy to be here.
Maybe we could begin, you could just tell our audience a little bit about your background. I've known you for a long time, but perhaps some of our viewers don't know you so well. So what got you to this point in your career?
I'm a pharmacist by background, so I've worked in and on behalf of pharmacies the last 20 years. Started as a technician, and this year I'm going to celebrate 20 years as a pharmacist. I've been with McKesson for 11 years, so I feel like each experience has built on each other. I started with the Health Mart franchise side and operations, and then clinical development, as well as strategy within the business as chief pharmacist. And I was really drawn to try to better understand one of our main pharmacy pain points around reimbursement and contracting. And so that brought me to Health Mart Atlas. And I had a few roles with Health Mart Atlas over the last 5 years, and was most recently the GM. So I would say this role to me feels a little bit like coming home back to Health Mart, but also having the component of contracting and pharmacy reimbursement as well.
With all that experience, you know Health Mart well. Maybe you could tell us a little bit about your view of Health Mart's place in the market today and what your priorities will be as you now become president.
In terms of Health Mart's place in the market, Health Mart is the largest independent pharmacy franchise, so we support pharmacies across all 50 states. And in terms of our overall focus, I would say we remain committed to really strengthening the overall health of our Health Mart pharmacies and elevating the role that they play in people's lives. And you'll see us focused really in 3 areas. The first is just the strong foundation of supply chain excellence. I think everything at McKesson, the pharmacy's experience starts there, and we'll continue to take that commitment very seriously. So everything from ordering accuracy, delivery excellence, and patient safety that really gives us the right to earn that pharmacy's business and hopefully take advantage of additional solutions like Health Mart and Health Mart Atlas. The second focus area is really around best-in-class pharmacy and patient solutions that address key pain points in the market. So we'll continue to develop solutions that we believe are best for community pharmacies and partner with the right companies to do that if they already exist in the marketplace. One example this last year was the implementation of Health Mart Atlas's DIR Assist, which was really a proactive solution to help pharmacies manage through the DIR changes that are taking place now in January. And we'll also be talking about a number of different solutions to help stores drive business at this year's McKesson Idea Share meeting, which is actually going to be taking place June 23rd through the 26th in New Orleans. Mm-hmm. And then finally, I would just say a focus on advocacy. I think this is more important now than ever, industry and legislative advocacy. And we want to be able to advocate on behalf of our Health Mart pharmacies, as well as give them the tools to do that at the local level, because there's no one better to do that than a local business owner with a local legislator or representative.
You mentioned the pain point of reimbursement. Maybe you could talk a little bit about what you're doing to help your customers with the current transition that you referenced in January.
With the transition now in January and the CMS updated rules around Medicare, we're not seeing the retroactive clawbacks anymore effective January 1st of this year. However, there's still this 5-month transitional period where PBMs are collecting DIRs from 2023. And so we started over a year ago, actually, educating our pharmacies and helping them understand this change, and also the DIR Assist solution that I mentioned to help them if they wanted to opt in to escrow funds in preparation. So really a lot of education, guides, and resources, as well as tools to predict for their individual pharmacy what that financial impact might be, so they could either set aside funds on their own in a high interest savings account or use one of our solutions. It's a little bit early to tell since we're only a few days into January, but for the most part, the changes are taking place as we expected. And so we're really here to be a resource for the pharmacies if they have any questions or concerns as they navigate this change.
Maybe you could talk about DIR reform a little more generally. Are you optimistic that either Congress or the executive branch will provide more relief for pharmacy in that respect?
Yeah, I think whether it's DIR or effective rates, there's all these different reimbursement methodologies that pharmacies are held to in their PBM contracts. I'm more optimistic than I've ever been around pharmacy specific advocacy and just momentum towards legislation, both in the states and at a federal level. And I'm optimistic not just for the reimbursement aspects of it, but also for practice advancement. Just the impact that the pharmacies had during COVID was just instrumental, whether it be vaccinations or testing and treatment. And so to continue to have additional legislation that allows them to practice at the top of their licenses or our licenses, that's going to be critical. So I think we need both pieces of legislation, just the fundamental reimbursement reform, but also a shift to be able to be reimbursed for the services that pharmacies already provide and new services that they may be able to provide in the future.
When you talk about new services, of course, that's something all pharmacy operators say they want to do. They want to expand their role and scope. Obviously, CVS or Walmart or Walgreens have tremendous resources to do that. Much more difficult for an independent pharmacy. What can you do to help your members with that transition?
Yeah, I find our independent pharmacies to be very agile. So I think when we have been able to provide, whether it's a vaccine program or the federal COVID vaccine partnership programs in the past, they're quick to activate. And so sometimes that can help with that speed to market, where it can sometimes take chains longer to make that transition. In terms of additional programs, one that's really been top of mind recently is social determinants of health. And we've done quite a few things to help support pharmacies in that area. One is through community health worker training and providing scholarships to pharmacy technicians in particular to be able to practice at the top of their scope to free up some time for pharmacists to be able to do the more clinical work. The other area is we, in partnership with our Global Impact Office, have provided findhelp.com to all of our Health Mart pharmacies, and that platform helps connect them to additional resources and social services that are needed in the community. And then I was very thankful for the opportunity to partner with Optum and focus on some pilots around social determinants of health, where the pharmacies played a role in screening and referral over to additional services, and they were compensated for that time for screening. So I'm hopeful for programs like that to continue to expand, and I really view our role to help enable or provide access to programs that maybe the independent pharmacies may not be able to get on their own, but we can bring that to them from a Health Mart perspective. So whether it's a federal partner program or a payer program, how do we help bring more of those types of opportunities to our Health Mart independents?
You talk about payers and their attitude toward pharmacy. It sounds like they're interested in pharmacy doing more for them. Are they also working with you on rethinking the reimbursement model in terms of fee for service as opposed to product?
I would say there's a lot of momentum around shifting the reimbursement models. We've seen several different approaches come out, some around more of a cost plus methodology for products, and then also some increased professional services or dispensing fees. I would say vaccines is really the area where we've seen the most payment for the service and administration fees. along with medication therapy management. A majority of payers are leveraging pharmacies for that. What I'd like to see continue to grow are other types of services where it's historically been more difficult for pharmacies to receive reimbursement. So whether that's test to treat or some additional consultative services, those are ones where we've had conversations or we've seen smaller pilot type of opportunities, but not large scale programs take hold.
Mhm. When we talk about these transitions and pharmacists doing more, to what degree are you counting on technology to make your members' operations more efficient and give them more time to spend with patients?
I think technology is going to be critical. It's an enabler. So it helps power the pharmacy, everything from pharmacy workflow platforms to be able to capture the clinical information like e-care plans, and then just the ability for the connectivity for technology to help enable payment. So I think several different types of technologies and maybe even technologies we're not thinking about yet are going to be necessary to make it possible in the future. And then also making sure that the pharmacy teams can communicate back to patients and also to the provider around the work they're doing and the impact that they're having. That oftentimes is best enabled through technology as well.
Mhm. When you talk about sharing information and communicating it back and forth, that raises the question of standards, of metrics. Are you hopeful that we're going to see a little more work in that area and give you tools to prove what your pharmacies are doing?
Yeah, I think there's a lot of opportunity around standardizing pharmacy quality level measures. So the Pharmacy Quality Alliance, or PQA, has done some work in this area across different stakeholder groups. So bringing technology providers, payers, pharmacies providers to the table. While there are some pharmacy quality measures that are in the marketplace now, there's still a lot of opportunity, in particular for more outcomes-based measures. So I'm hopeful for the work that work will continue, and that's an area that I'm personally passionate about. I just recently joined the PQA board, and I think there's a lot more work that can be done there, but we also need to make sure we have the right stakeholders at the table, including payers, so that when these measures are created, that they can actually be implemented in some of the payer programs, which I think is ultimately everyone's goal.
Let me ask you a final question. We've talked about some of the opportunities, some of the threats for pharmacy as a whole and independents in particular. Are you optimistic that Health Mart and other independents will be able to continue to thrive going forward despite the challenges?
I'm optimistic. I feel like independent pharmacies owners are some of the most resilient people that I've ever met, and they find a way and a path forward. I do think we need real meaningful reform to help enable advancement of services and keep their business models thriving and relevant into the future. But I'm confident that we'll find that path forward together and to help support them to support their communities.
One quick follow-up. As you look at the market, people coming out of pharmacy school, how many of them want to get into the independent space as opposed to chain pharmacy?
I've been surprised around the continued interest in pharmacy ownership. We actually have an RX ownership program that helps, whether it be students coming out of school or previous pharmacists that maybe worked for a chain or independent, start up their own pharmacy. So there continues to be interest in that area, and I hope to see it continue to grow. And I think just to be able to have that support, whether it's a financial review or assistance with the store development and design services, just to have that complete support. That's what we're here to help provide.
No, it's great to hear, and I know Health Mart is invaluable to its membership. So congratulations again on your appointment, and thank you for taking the time to talk with me today.
Thank you, Jeff. I really appreciate the opportunity, and I'm so excited about what Health Mart's pharmacies can do to continue to serve their communities.